The SEAL commander refused help until the nurse showed her unit tattoo. "I don't care what your chart says," Commander Davenport rasped, his hand clamping over the torn edges of his dressing. "Nobody touches this leg unless they've been in the dirt. Get these civilian hands off me." Dr. Sunfield sighed, adjusting her stethoscope. "Commander, your infection is spreading. We are administering antibiotics now. Try it, Doc, and see what happens." From the corner, Nurse Celeste Northcott watched the monitor spike. She stepped forward, her voice low and steady. "Doctor, his pressure is dropping. He's not being stubborn. He is crashing now." The clinical detachment of the trauma bay shattered the moment Celeste's words cut through the sterile air. The monitors, which had been chiming with a steady, irritating cadence, suddenly pitched into a shrill, unbroken scream. Raphael Davenport, a man who had survived things the government would never put on paper, violently arched off the mattress. His skin, previously a sickly, pallid gray from the spreading sepsis, flushed with the sudden, toxic rush of a failing cardiovascular system. The stubborn defiance in his eyes glazed over, replaced by the primitive, hollow stare of a body actively dying. Dr. Daphne Sunfield froze. For a fraction of a second, the brilliant attending physician, whose published papers on traumatic infectious diseases were treated as gospel in the corridors of the Federal Medical Center, was paralyzed by the visceral reality of a combat operator crashing out of her algorithm. She had treated the numbers. She had treated the chart. She had not treated the man who had been running on pure adrenaline and defensive hostility for the last 48 hours. "Push 1 milligram of epinephrine!" Sunfield finally barked, her voice an octave higher than usual, the pristine authority of her tone cracking under the sudden chaos. "Get him flat! We need a central line kit. Now! Mina, start bagging him." Dr. Mina Gainsborough, a first-year critical care fellow whose hands were visibly shaking, fumbled with the wall-mounted oxygen flowmeter. Clarissa, a junior floor nurse, stood completely still, her eyes wide as she stared at the heavily scarred, heavily muscled SEAL, thrashing weakly against the bed rails as his brain was starved of oxygen. Only Celeste moved with purpose. She did not run. She did not raise her voice. In a room consumed by sudden panic, she existed in a pocket of profound, practiced silence. Her movements were brutally efficient, devoid of wasted motion. Before Dr. Sunfield had even finished calling for the epinephrine, Celeste already had the pre-filled syringe palmed. She bypassed the compromised peripheral IV that Davenport had nearly ripped out moments before, cleanly accessing the secondary line near his collarbone. "Epi in," Celeste stated, her voice a flat, calm baritone that seemed entirely out of place in the screaming room. She didn't wait for Sunfield's next order. Celeste reached past the frozen Clarissa, grabbing the ambu bag and pressing it firmly over Davenport's mouth and nose. She established a perfect seal on the first try, timing the compressions of the bag with the erratic, failing rhythm of his chest. As she leaned over him, a small, worn object swung forward from her ID badge reel, a blackened titanium carabiner, the paint chipped away at the edges to reveal the dull, indestructible metal beneath. It was heavy, non-standard, and completely ignored by the hospital administration. It clinked softly against the steel bedrail, a tiny, metallic heartbeat amidst the chaos. "Heart rate is coming up," Celeste noted, her eyes glued to the monitor while her hands worked the bag. "Pressure is stabilizing. He's trying to breathe over the bag." Sunfield exhaled sharply, wiping a bead of sweat from her forehead. She stepped back, straightening her pristine white coat as if trying to physically smooth out the loss of control she had just exhibited. She looked at Celeste, her expression tightening into a mask of rigid authority. "I have the airway, Nurse Northcott," Sunfield said coldly, stepping in to take the ambu bag. "Fetch the central line kit. And next time, wait for my explicit order before pushing a vasopressor." Celeste met Sunfield's gaze for a second longer than was deferential. She didn't argue. She didn't point out that waiting for the order would have resulted in an irreversible anoxic brain injury. She simply released the bag, stepped back into the periphery, and nodded. "Yes, doctor." The high-acuity wing of the medical center was supposed to be the premier destination for returning federal casualties, a place where the absolute bleeding edge of medical science met the raw, shattered realities of the battlefield. But to Celeste, it often felt like a highly polished factory. The floors were gleaming linoleum, the walls painted a soothing, focus-grouped shade of seafoam green. It smelled aggressively of bleach, chlorhexidine, and institutional arrogance. Celeste moved to the supply closet, her soft-soled shoes making no sound. At 34, she was older than most of the floor nurses, but she possessed a quiet, unassuming demeanor that made her virtually invisible to the higher-ups. She wore standard-issue navy blue scrubs, her dark hair pulled back into a severe, utilitarian bun. There was no makeup, no jewelry, nothing to draw the eye except for the blackened carabiner, and the way she scanned a room. She didn't just look at people. She assessed them, reading their posture, their breathing rates, the micro-expressions of pain or fear they tried to hide. Vera, the veteran charge nurse, intercepted Celeste in the hallway outside the supply room. Vera was a force of nature, a woman who had run this floor for 2 decades and knew exactly how the political games were played. "You stepped on Sunfield's toes," Vera said quietly, leaning against the doorframe, her arms crossed. "It wasn't a question." "The patient was bottoming out," Celeste replied, selecting a sterile drape and a triple-lumen catheter kit from the shelf. Sunfield was focused on the local infection. She missed the systemic shock. "I know that. You know that," Vera sighed, rubbing her temples. But Daphne Sunfield just got her 2nd grant from the Department of Defense. In her mind, she's the admiral of this ward. You're just a deckhand. She will bury you in write-ups if you embarrass her in front of the fellows. "I'm not here to embarrass anyone, Vera. I'm here to keep the man alive." "He's a nightmare," Vera said, looking down the hall toward Davenport's room. "Clarissa is terrified of him. The orderlies don't want to go in there to change his sheets. He's a Navy SEAL, fresh off a classified kinetic strike in some sandbox we aren't supposed to know about. His leg is essentially ground meat. He's brewing a massive infection, and he trusts absolutely no one. He refused his pain meds yesterday because he said it made him slow. The man is fighting a war in a hospital bed." "He's not fighting a war," Celeste said softly, her fingers tightening slightly on the plastic wrapper of the central line kit. "He's just trying to hold the perimeter. He's exposed, he's immobilized, and every instinct he has is screaming that he's in danger." Vera looked at Celeste carefully, her eyes narrowing. Vera had always suspected there was more to Celeste Northcott than a nursing degree from a state college. Celeste had arrived 3 years ago with a resume full of vague civilian contractor jobs overseas and a flawless, almost unnerving level of technical skill. "Just watch your back, Celeste," Vera warned. "Sunfield is going to use him to prove a point. Don't get caught in the crossfire." Celeste nodded, walking back down the long, bright corridor. She paused outside Davenport's room, looking through the glass observation window. The SEAL was stable for the moment, lying flat, his chest rising and falling with machine-like regularity. But even in his unconscious state, his jaw was clenched, his hands balled into loose fists by his sides. Celeste recognized the posture. She knew the exact weight of the darkness behind his closed eyes. She touched the blackened titanium carabiner at her hip, took a slow, deep breath, and pushed the door open to re-enter the battle space. 12 hours later, the morning sunlight filtered through the reinforced blinds of the ICU, casting sharp, geometric shadows across the linoleum floor. The artificial dawn did nothing to soften the sterile hostility of room 412. Commander Raphael Davenport was awake, heavily feverish, and deeply entrenched in a state of absolute psychological lockdown. Morning rounds in Dr. Daphne Sunfield's unit were less of a collaborative medical discussion and more of a royal procession. Sunfield led the charge, flanked by Dr. Gainsborough, 2 medical students, a pharmacist, and Vera. Celeste brought up the rear, pushing the mobile charting station, blending perfectly into the background noise of the hospital hierarchy. Davenport watched them enter. He was propped up at a 45-degree angle, his eyes tracking every individual who crossed the threshold. He didn't look at their faces. He looked at their hands, their waists, their avenues of approach. His left leg, heavily bandaged and bolted into an external fixation device, lay elevated on a stack of sterile pillows. Beneath the gauze, a nasty, antibiotic-resistant strain of bacteria was eating into the bone. "Commander Davenport," Sunfield announced, stopping at the foot of the bed. She did not make eye contact, instead fixing her gaze on the digital tablet Gainsborough handed her. "Your white count is climbing. The peripheral antibiotics are not penetrating the bone tissue effectively. The temporary crash yesterday underscores the severity of the systemic response." Davenport said nothing. He simply stared at Sunfield, his face a mask of scarred granite. He had a jagged laceration running from his left temple down into his beard, the skin pulled tight and angry. Sunfield continued, her tone brisk, educational, performing for the medical students rather than addressing the patient. We are going to escalate the treatment protocol. Doctor, Gainsborough will be inserting a peripherally inserted central catheter, a PICC line, into your right arm this morning. This will allow us to deliver high-dose, continuous vancomycin directly to your heart. Additionally, we will need to schedule a surgical debridement of the wound bed for tomorrow morning. No, the word was quiet, hoarse, but it carried the absolute, immovable weight of an anvil dropping onto a glass table. Sunfield finally looked up from her tablet, blinking in genuine confusion. "Excuse me? I said no," Davenport repeated, his voice grating like two stones grinding together. "Nobody is cutting into me again, and nobody is running a line to my heart. You keep pumping me full of whatever is in those bags, but I am not going back to sleep, and I am not giving you control of my central systems." Sunfield offered a tight, patronizing smile. "Commander, I understand that you have been through a traumatic event. You are experiencing a significant amount of pain, which can cloud your judgment, but I assure you, this is standard protocol for a grade 3 open fracture with osteomyelitis." "Doc," Davenport said, leaning forward slightly, the muscles in his neck standing out like steel cables, "I don't give a damn about your standard protocol. I've been blown up, shot, and dragged through 3 miles of mud. I know what dying feels like, and I know what surviving feels like. Right now, I am chemically compromised. If you put me under for a debridement, I will lose my situational awareness. That is a negative. You are in a hospital in Virginia, Commander, not a combat zone," Sunfield said, her voice taking on a sharp, scolding edge. "There is no situational awareness required here. You are safe. You need to be compliant so we can save your leg." From her vantage point by the door, Celeste watched the interaction with a rising sense of dread. Sunfield was making every possible psychological error. She was invalidating his reality, stripping away his agency, and demanding compliance through authority rather than establishing trust. To an operator like Davenport, whose entire survival depended on hypervigilance and control, Sunfield was no longer a caregiver. She was a threat vector. "I am not signing off on the surgery," Davenport stated, his eyes locking onto Sunfield with a terrifying, predatory intensity. "And if your resident comes near me with that needle, I will break her wrist." Mina Gainsborough audibly gasped, taking a quick step backward and bumping into a tray stand. The medical students exchanged nervous, wide-eyed glances. Sunfield's face flushed an angry, mottled red. Her authority had been publicly challenged in front of her subordinates, a cardinal sin in her fiercely protected ecosystem. "Are you threatening my staff, Commander?" "I am stating a tactical reality," Davenport replied evenly, though a sheen of sweat on his forehead betrayed the massive physiological toll the argument was taking on his weakened body. "Maintain your distance." "This is unacceptable," Sunfield snapped, turning to Vera. "Charge nurse, page hospital security. I want 2 guards outside this door. If the patient refuses necessary, life-saving care, we will heavily sedate him, declare him temporarily incompetent due to delirium, and proceed with the central line placement under restraints." Vera hesitated, her eyes flicking toward Celeste. Vera knew the paperwork and the legal nightmares that accompanied forced sedation on an active-duty military officer. But Sunfield was the attending. Her word was medical law. "Dr. Sunfield," Celeste said. Her voice was soft, barely above a whisper, yet it instantly commanded the acoustic space of the room. Sunfield whipped her head around, glaring at Celeste. "What is it, Northcott?" "If you attempt to restrain him," Celeste said carefully, keeping her hands visible and her posture non-threatening, "his sympathetic nervous system will redline. With his current fever and weakened cardiac state, forcing him into a physical struggle will likely induce a massive hypertensive crisis. He will code again, and this time, he might not come back." Sunfield drew herself up to her full height. "Are you offering me a medical diagnosis, nurse?" "I am offering an observation of his baseline physiology," Celeste replied evenly. She stepped slightly away from the charting station, moving just a fraction of an inch closer to the bed. "He is an elite operator. His central nervous system is wired to fight through chemical sedation if he perceives a threat. If you push a sedative while he is in a defensive posture, you will not put him to sleep. You will trap him in a dissociative nightmare where he is fighting for his life against his own body. We need to de-escalate." Davenport's eyes snapped to Celeste. It was the first time he had truly looked at her. Through the fog of his fever and the red haze of his defensive anger, his sharp, analytical mind registered her posture. She wasn't standing like a nurse. Her feet were shoulder-width apart, her center of gravity low. Her hands were relaxed but positioned near her waist, ready to move. "I do not need a lecture on pharmacology from a floor nurse," Sunfield hissed, her ego entirely eclipsing her clinical judgment. "Page security. Get the restraints. Draw up 5 milligrams of midazolam. We are doing this now." Celeste felt the cold, familiar weight of the blackened titanium carabiner against her hip. The room was spiraling toward a violent, potentially fatal collision. Sunfield was blinded by protocol and pride. Davenport was blinded by trauma and survival instinct. The gap between them was a kill zone, and Celeste realized, with a heavy, sinking feeling in her chest, that she was the only one in the room equipped to cross it. The air in room 412 turned thick, electric with the imminent promise of violence. 2 hospital security guards, hefty men in tight polo shirts, appeared in the doorway, their hands resting uncertainly near their utility belts. They had dealt with combative drunks and confused dementia patients, but the man in the bed was a different breed of apex predator. Even broken and feverish, Davenport radiated a lethal, coiled energy. "Stand by," Sunfield ordered the guards, her voice trembling slightly with a mixture of fear and adrenaline. She turned to Clarissa, the junior nurse. "Clarissa, bring me the midazolam. Mina, prep the pick tray. The moment he is sedated, we move fast." Clarissa, her face pale, approached with a loaded syringe on a small plastic tray. Her hands were shaking so badly the syringe rattled against the plastic. Davenport didn't shout. He didn't thrash. He simply shifted his weight, pulling his massive, uninjured right arm close to his chest, ready to strike. "Don't do this, Doc," he warned, his voice dropping to a terrifying guttural register. "You cross that invisible line, and I will defend myself. I don't care about your degrees." "Hold him," Sunfield commanded the guards. The 2 men stepped forward, reaching for Davenport's shoulders. "Stop." The word wasn't shouted, but it cracked through the room like a rifle shot. Celeste moved. She didn't rush, but her speed was deceptive. In 2 fluid steps, she placed herself directly between the security guards and the bed, her back to Davenport, facing Dr. Sunfield. Sunfield stopped dead in her tracks, staring at Celeste as if the nurse had just sprouted a second head. "Nurse Northcott, what are you doing? Step aside immediately. You cannot do this, Doctor." "Sunfield," Celeste said, her voice remaining intensely calm, though her eyes were locked onto the attending physician with unyielding force. "You are treating a psychological trauma response as a disciplinary issue. If you put hands on him, he will tear his rotator cuff fighting the restraints, he will dislodge the external fixator on his leg, and the resulting stress will rupture his weakened vasculature. You are going to kill him to prove a point." The silence that followed was absolute. The monitors beeped in the background, measuring the frantic, elevated heart rate of the man in the bed. Sunfield's face went rigid. The public defiance was a direct assault on her professional identity. She took a step closer to Celeste, her voice dropping into a vicious, sibilant hiss designed to cut. "You are a nurse, Northcott," Sunfield said, ensuring every person in the room heard the venom in her words. "You wipe down beds. You hang, saline. You do not dictate treatment. And you absolutely do not countermand my orders. Do not confuse your blue scrubs with my white coat. You lack the education, the authority, and the clearance to understand the decisions I am making. Now, step away from the bed, or I will have security remove you, and I will personally see to it that your license is revoked before the sun goes down." It was a public execution of character. Mina looked at the floor. Clarissa whimpered slightly. Vera closed her eyes, knowing Celeste had just crossed the Rubicon. Celeste stood perfectly still. She absorbed the humiliation without a flinch, her expression utterly impassive. She had endured the screaming of warlords in the Hindu Kush and the roar of incoming mortar fire in Mosul. The petty, bureaucratic wrath of a hospital-attending physician barely registered on her nervous system. She faced a clear moral choice. If she stepped aside, she kept her job, her pension, and her quiet, anonymous life. If she stood her ground, she would be fired, disgraced, and thrown back into the chaos she had spent 3 years trying to escape. Celeste looked over her shoulder. Davenport was watching her. The frantic, cornered animal look in his eyes had slightly shifted, replaced by a profound, calculating confusion. He was analyzing her. He was trying to figure out why a civilian nurse was throwing away her career to shield a man she didn't know. Celeste made her choice. Security, Celeste said, not looking at the guards, her eyes fixed on Sunfield. Do not touch the patient. Remove her! Sunfield shrieked, finally losing her composure. As the guards stepped forward, Celeste turned her back on Sunfield entirely. She faced Davenport. She didn't lean over him. She kept a respectful, tactical distance, remaining just outside his striking range. Commander Davenport, Celeste said, her voice completely changing. The soft, deferential tone of the civilian nurse vanished. Her cadence became clipped, rhythmic, and brutally direct, the universal frequency of the operator. Your heart rate is 140. Your respiratory rate is 28. You are running a fever of 103.4, Celeste stated, maintaining unbroken eye contact. You are experiencing a hyperadrenergic response due to sepsis. You are not under fire. You are inside the wire. Your perimeter is secure, but your internal systems are failing. Davenport blinked, his right hand slowly unclenching just a fraction. Who the hell are you? He rasped. My name is Celeste, she replied evenly. And I am telling you, operator to operator, that the enemy right now is in your bloodstream, not in this room. If you fight this staff, you will bleed out from a stress-induced rupture. You need the IV. You need the antibiotics, but you do not need the sedatives. She turned slightly, extending her hand toward Clarissa. Give me the midazolam. Clarissa, paralyzed by the conflicting authorities, looked at Sunfield, then at Vera. Vera gave a microscopic, almost imperceptible nod. Clarissa handed the syringe to Celeste. Celeste didn't put it in her pocket. She held it up so Davenport could clearly see it. Then she calmly turned and deposited the loaded syringe directly into the red biohazard sharps container on the wall. It hit the bottom with a hollow plastic thud. The sedatives are gone, Celeste said, turning back to Davenport. Nobody is putting you to sleep. Nobody is taking your awareness. But you are going to let me place the central line. Just you and me. I will talk you through every single movement before I make it. No surprises, no blind spots. Do we have a deal, Commander? Davenport stared at her. He looked at the sharps container, then back at the calm, unflinching woman standing before him. The manic tension in his jaw slowly began to recede. He recognized the tone. He recognized the absolute, unshakable competence in her eyes. It was a language he understood. Doc says I need surgery tomorrow, Davenport said, his voice lower, the hostility replaced by a weary, guarded caution. I'm not going under the knife blind. If you let me place this line, Celeste said quietly, I will personally stand in the OR with you tomorrow. I will monitor your sedation. I will be your overwatch. Davenport studied her for a long, agonizing moment. The silence in the room was deafening. Sunfield was seething, preparing to unleash hell, but even she was momentarily silenced by the shift in the patient's demeanor. Slowly, agonizingly, Davenport lowered his right arm. He uncurled his fist and laid his hand flat on the mattress. Move slow, nurse, Davenport whispered, his eyes locking onto hers. You have the green light. The silence in room 412 was absolute, heavy with the adrenaline that had just flooded the space. Doctor, Daphne Sunfield stared at the sharps container where the sedatives had vanished, her face a rigid mask of fury and humiliated disbelief. The two security guards, entirely unsure of their legal standing, slowly backed out into the hallway. Dr. Gainsborough, Sunfield said, her voice dropping to a terrifying, glacial whisper. You will accompany me? We are leaving. Nurse Northcott has assumed full liability for this patient. I am going to the Director of Nursing's office to file the paperwork for immediate termination and license review. She did not look at Celeste again. The attending physician turned on her heel, her pristine white coat snapping with the violence of her pivot, and marched out of the room. Mina Gainsborough threw one terrified, apologetic glance at Celeste before scurrying after her mentor. Clarissa remained, frozen against the wall. Clarissa, Celeste said, her voice returning to its normal calm cadence. I need you to fetch the portable ultrasound machine from the equipment bay. Then, I need you to stand by the door and ensure we are not interrupted. The junior nurse nodded frantically, eager for a clear directive, and vanished. Celeste turned her attention entirely to the man in the bed. Commander Raphael Davenport had not relaxed. His eyes were tracking her every movement, analyzing her baseline. He was waiting for the trick, the sudden shift in demeanor that would signal a threat. "I am going to move the bedside table to your right," Celeste stated, suiting action to word. She pulled the stainless steel mayo stand closer, adjusting its height. "I am opening the sterile PICC tray now. You will hear plastic crinkling. I am placing a sterile drape over your chest and right arm." "I know what a PICC line is," Davenport rasped, his breathing still shallow, though his heart rate on the monitor was beginning a slow, jagged descent. "I've had medics punch them into me in the back of C-130S. What I don't know is why a floor nurse just torched her entire career for a stranger." "Because you were about to fight 2 security guards and tear your femoral artery to pieces, Commander," Celeste replied smoothly. She cracked the chlorhexidine applicator, the sharp snap of the plastic echoing in the quiet room. She began to aggressively scrub the skin of his inner bicep, her movements firm and practiced. "And because I don't like watching civilian doctors treat combat trauma responses as behavioral issues, it's bad medicine." Davenport watched her hands. They were entirely steady. There was no tremor of residual adrenaline, no hesitation. As she leaned over to apply the sterile blue drape, the blackened titanium carabiner on her hip lightly clinked against the metal bedrail. Davenport's eyes snapped to the object. He studied the chipped paint, the heavy-duty locking mechanism, the specific, non-standard shape of the metal. It was a climbing carabiner, but not the kind sold in sporting goods stores. It was rated for tactical insertion, the kind used for fast roping out of blacked-out helicopters. "You didn't answer my question," Davenport pushed, his voice dropping an octave, testing her. "Where did you serve?" "I am a civilian registered nurse, Commander," Celeste answered seamlessly. She squeezed a dollop of cold acoustic gel onto the ultrasound probe. "You will feel cold jelly on your arm now. I am looking for the basilic vein. It provides the straightest shot to your superior vena cava." "Bullshit," Davenport growled softly. The fever was making his eyes bright, but his mind was locking onto the puzzle of the woman in front of him. Civilians flinch when a man my size threatens to break a wrist. Civilians look for the exits. You stepped into the kill zone and pushed the threat out. You cleared the room without raising your voice. Celeste kept her eyes on the ultrasound screen, watching the pulsing black circles of his vasculature. "Vein located," she murmured. "I am inserting the needle now. You will feel a sharp pinch, followed by pressure." She guided the needle in with a fluidity that bordered on mechanical perfection. Davenport didn't flinch. He just watched her. "Who trained you?" he demanded quietly. "State College," Celeste replied, her face impassive. She threaded the guide wire through the needle hub. "Wire is in. I am advancing the catheter." Davenport let out a short, harsh breath that might have been a laugh if his chest wasn't on fire. "You lie flawlessly, nurse. I'll give you that. But your posture is all wrong for this environment. You keep your back to the wall. You scan the hands of everyone who walks in, and you talk to me like an operator." "I talk to you like a patient who needs a systemic antibiotic," Celeste said. She removed the wire, secured the catheter with a stat lock, and attached a pre-filled saline syringe. "I am flushing the line. You may feel a cool sensation in your chest." She depressed the plunger. The line flushed perfectly, drawing back a flash of dark red venous blood to confirm placement. In under 5 minutes, she had accomplished what an entire team of anxious doctors had failed to do. She stripped her sterile gloves, tossing them into the biohazard bin, and finally looked him in the eye. "The line is secure, Commander," Celeste said softly. "I kept my end of the bargain. You are awake. You have your situational awareness. And tomorrow, when they take you down for surgery, I will be the one standing over your head." Davenport stared at her, the hostility finally draining out of his posture, leaving only profound exhaustion. "They're going to fire you for what you did to that doctor." "That is my perimeter to hold," Celeste replied, touching the blackened carabiner on her hip. "You just focus on holding yours." The summons came precisely 45 minutes later. Vera, the veteran charge nurse, intercepted Celeste at the nurse's station. Vera's face was drawn, her jaw tight. She didn't speak immediately. She just looked at Celeste, mourning the inevitable loss of the best clinician on her floor. "They want you in the chief medical officer's suite," Vera said quietly, handing Celeste a printed email. Sunfield skipped the nursing director entirely and went straight to the top. She's claiming you created a hostile clinical environment, endangered a patient, and committed gross insubordination. I placed the PICC line, Celeste noted, signing off on a patient chart with a steady hand. Blood cultures are drawn, and the first dose of vancomycin is running. His heart rate is down to 95. It doesn't matter, Celeste, Vera sighed, rubbing the bridge of her nose. This isn't about patient outcomes. This is about hierarchy. Sunfield brings in millions in Defense Department research grants. You are a disposable line item on the payroll. They are going to make an example out of you. I understand, Celeste said. She closed the chart and stood up. For what it's worth, Vera added softly, looking toward the hallway where room 412 was located. You were right. If Sunfield had pushed that sedative, he would have coded. You saved his life today. Tell Mina to watch his fever, Celeste instructed, ignoring the praise. The antibiotics will cause a bacterial die-off. His temperature is going to spike again before it breaks. He's going to get worse before he gets better. The walk to the executive wing was a transition between worlds. The smell of bleach and illness faded, replaced by the scent of polished mahogany, expensive espresso, and the sterile quiet of bureaucracy. Doctor. Daphne Sunfield was already seated at the massive conference table when Celeste entered. She sat rigidly, her posture radiating vindictive triumph. At the head of the table sat Dr. Elias Vance, the chief medical officer, a man who had not touched a patient in 15 years, preferring spreadsheets to stethoscopes. Nurse Northcott, Dr. Vance began, not offering her a seat. He folded his hands atop a thick file folder. I have just received a highly disturbing verbal report from Dr. Sunfield regarding your conduct in the ICU this morning. She alleges that you physically obstructed a medical procedure, discarded controlled substances without authorization, and publicly undermined an attending physician. The patient was entering a hyperadrenergic trauma state. Dr. Vance, Celeste replied, her voice remaining perfectly level. She stood with her hands clasped loosely behind her back, a parade rest so deeply ingrained, she didn't even realize she was doing it. Chemical restraint would have triggered cardiovascular collapse. I de-escalated the situation and successfully placed the required central line. Sunfield slammed her hand onto the table. You have no authority to make that clinical judgment. You are a nurse. You follow orders. You do not practice medicine. I practice survival, doctor, Celeste countered, shifting her gaze to Sunfield with a cold, piercing intensity. The patient is a Tier 1 operator, suffering from acute sepsis and combat trauma. You treated his defensive posture as a behavioral infraction. You were going to kill him out of sheer institutional pride. Dr. Vance held up a hand, cutting off Sunfield's furious response. Regardless of the outcome, Nurse Northcott, your actions represent a catastrophic breach of protocol. You cannot exist outside the chain of command. We cannot have rogue staff members making unilateral decisions. The chain of command was compromised by ego, Celeste stated flatly. Vance's eyes narrowed. Effective immediately. You are suspended without pay pending a full review by the medical board. You will surrender your badge. You are to clear out your locker and vacate the premises. You are no longer authorized to be in the clinical wings. Celeste did not argue. She knew how the machine worked. She reached up, unclipped her hospital ID badge from the blackened titanium carabiner, and placed it on the polished mahogany table. It made a soft, final click. Watch his fever, Celeste said to Vance, though her eyes were on Sunfield. The infection has breached the bone. He's going to go critical tonight. Without waiting for a dismissal, Celeste turned and walked out of the executive suite. She took the service elevator down to the basement locker rooms. It was quiet here, isolated from the hum of the hospital. She opened her metal locker and began methodically placing her few personal items into a small duffel bag. She felt no regret. She had made the only tactical choice available to her. As she zipped the bag closed, her cell phone buzzed. It was a text from Vera, code blue averted, but he's crashing. Sepsis is galloping. Fever 105. Sunfield moved the surgery up. They are taking him to the OR right now for emergency debridement. He's delirious. He's fighting the transport team. He's screaming for his overwatch. Celeste stared at the screen. She was officially a civilian. She was suspended. Setting foot in the OR could result in criminal trespassing charges. She looked down at the blackened carabiner still clipped to her scrub pants. It was a relic from a life she had tried to bury, a reminder of the oath she had taken long before she ever wore hospital scrubs. Celeste dropped her duffel bag on the floor, turned around, and broke into a dead sprint toward the surgical wing. The pre-operative staging area outside Operating Room 4 was a scene of barely controlled chaos. Commander Davenport was strapped to a transport gurney, but the nylon restraints were straining against their buckles. His fever had peaked, plunging his mind back into the suffocating darkness of a combat zone. He was no longer in a hospital in Virginia. He was trapped behind enemy lines, surrounded by hostile actors whose faces were obscured by blue surgical masks. Dr. Aris, the senior anesthesiologist, was losing his patience. He held a syringe of propofol, hovering near the IV port of the central line Celeste had placed. "Hold his arm down," Aris barked at the two burly surgical orderlies. "If I push this while his heart rate is at 160, his pressure is going to bottom out. I need him still." "I told you not to touch me!" Davenport roared, his voice a ragged, terrifying sound that rattled the stainless steel equipment trays. He violently twisted his torso, using his massive right arm to grab the railing of the gurney, his knuckles turning white. "Where is she? Where is the Overwatch?" Dr. Sunfield, who had rushed down to oversee the emergency procedure, stood near the double doors, her face pale but her expression unyielding. "The nurse is gone! Commander, you are hallucinating! Dr. Aris. Sedate him immediately before he tears the fixator out of his leg." "You come near this line," Davenport snarled, locking eyes with the anesthesiologist, "and I will snap your neck." The threat was not hyperbole. Even gravely ill, the sheer kinetic potential coiled in Davenport's body paralyzed the medical staff. The orderlies stepped back. Dr. Aris lowered the syringe. Institutional authority had entirely failed against the raw, primal reality of a cornered apex predator. The double doors to the pre-op staging area blew open. Celeste strode into the room. She was not wearing the required surgical gown, bouffant cap, or shoe covers. She was in her standard navy blue scrubs, her face set in lines of absolute, terrifying focus. "Stop right there," Sunfield screamed, stepping forward to physically block Celeste. "You are suspended. You are trespassing. Security is on their way." Celeste didn't even break stride. She didn't push Sunfield. She simply walked through her airspace with such overwhelming authoritative momentum that the attending physician instinctively recoiled, stumbling backward into a linen cart. "You read the chart." "I read the battlefield." Celeste delivered the words with devastating precision, her voice cutting through the panic of the room. She bypassed the anesthesiologist and stepped directly to the head of Davenport's gurney. Davenport's wild, fever-bright eyes locked onto her. His breathing was ragged, his chest heaving. You left the perimeter." "I am right here, Commander," Celeste said softly, her voice immediately dropping into that rhythmic, operator frequency. "I told you I would be your Overwatch. I hold the line." "They're trying to put me under," he choked out, his grip on the bedrail tightening until the metal groaned. "I can't go dark. Not with them." "You are going dark with me," Celeste said. "Nurse Northcott, I am having you arrested." Sunfield shrieked from the back of the room. "Dr. Aris, do not let her touch the equipment." Celeste ignored the screaming doctor. She looked down at Davenport. She knew that words were no longer enough. His paranoid, fever-addled brain needed absolute, undeniable proof of allegiance. He needed to know, beyond a shadow of a clinical doubt, exactly who was holding his life in her hands. With deliberate slowness, keeping her eyes locked on Davenport, Celeste reached up to the collar of her navy blue scrub top. In one sharp, tearing motion, she ripped the V-neck downward, exposing her left collarbone and the anterior quadrant of her left shoulder. The surgical staff gasped. It wasn't the violation of the dress code that shocked them into silence. It was the stark, pitch-black ink permanently etched into her pale skin. It was not a decorative tattoo. It was an emblem forged in secrecy and blood. A winged dagger pointing downward, wrapped in the serpent of Asclepius, resting over a Roman numeral, the highly classified, globally unacknowledged insignia of the Joint Medical Augmentation Unit, the Tier 1 medical operators who deployed exclusively with JSOC and DevGru into the most hostile environments on Earth. It was a tattoo that could only be earned by enduring the exact same horrors Davenport had survived. It meant she had been in the dirt, It meant she had held arteries closed under mortar fire. It meant she was one of them. The silence that crashed over the pre-op area was absolute, suffocating, and profound. The room suddenly understood, with a collective, sickening wave of realization, exactly who Daphne Sunfield had been trying to humiliate all morning. Davenport stared at the black ink on her shoulder. The manic, hunted look in his eyes vanished, replaced instantly by the deeply ingrained, physiological response to superior command structure and absolute trust. Slowly, his white-knuckled grip on the bedrail relaxed. His hand fell to his side. He looked up at Celeste, his breathing steadying. "Overwatch is on station," Davenport whispered, closing his eyes. "You have control, Doc." Celeste pulled her scrub top back into place. She turned to the paralyzed anesthesiologist, her eyes cold and commanding. "Push the propofol, Dr. Eris," Celeste ordered. And this time, no one in the room dared to question her authority. The heavy doors of Operating Room 4 sealed shut, replacing the chaotic pre-op staging area with the frigid, sterile calm of the surgical theater. Under the blinding halogens, Commander Raphael Davenport finally surrendered to the chemical darkness. Dr. Eris, the senior anesthesiologist, exhaled a shuddering breath as Davenport's erratic heart rate smoothed into the deep rhythm of general anesthesia. Eris looked across the patient's head at Celeste. She stood perfectly still in her unauthorized blue scrubs, monitoring the glowing readouts with the precision of a drone operator. "Good call on the propofol," Eris murmured, his voice laced with newfound respect. He had seen the tattoo. If we pushed it while he was fighting, his vascular resistance would have collapsed. "Keep him deep, doctor," Celeste replied softly. "If he lightens up, his brain will interpret the surgery as an active combat injury." "At the scrub's sink, doctor." Daphne Sunfield violently washed her forearms, her face an unreadable mask of humiliation. The revelation of Celeste's Tier 1 medical background had detonated her worldview. The nurse she had dismissed was a master of a medical discipline so elite that Sunfield couldn't fathom it. 2 security guards suddenly buzzed into the room. "We have a report of a suspended employee trespassing," one announced. Before Sunfield could order an arrest, Dr. Eris stepped between the guards and the bed. "Get out," Eris barked. "If you bring an altercation into my OR, this man will die. Stand down." Sunfield, knowing a code on the table would destroy her DoD funding, gave a stiff nod. The guards retreated. The surgery began. For 45 minutes, the room was filled with the brutal sounds of orthopedic debridement as Sunfield scraped away necrotic bone. Suddenly, Celeste noticed a microtrend on the arterial line. "Eris," she whispered, "the systemic inflammatory response is dilating his periphery. He's going to bottom out in 3 minutes. Push 50 mics of neosynephrine. Now." Eris hesitated, then looked at the black ink peeking from her collar. He pushed the vasopressor. 2 minutes later, Sunfield made a massive resection. The monitor shrieked a low-pressure warning, but thanks to the preemptive medication, the pressure instantly rebounded. "What happened?" Sunfield asked, eyes wide. "Pressure dropped. Vasopressors administered," Eris reported calmly. "He is stable." Sunfield looked at Celeste, realizing the nurse she tried to fire had just kept her patient alive. Celeste simply touched the blackened carabiner at her hip, holding the line until the last stitch was thrown. 14 hours later, the surgical ICU was quiet. The infection had been excised, the antibiotics were winning, and Davenport's fever had definitively broken. He woke slowly, the frantic urgency gone, replaced by hollow exhaustion. He turned his head. Celeste was sitting beside his bed in civilian clothes, a dark Henley and tactical pants. The blackened carabiner hung from her belt loop. "You stayed," Davenport rasped. "I told you I was your Overwatch," she replied. He noticed her clothes. "You lost your badge." "It's just plastic," Celeste said quietly. Davenport stared at her belt. "That carabiner. It's a heavy lift rig." Celeste unspooled it, the hospital light catching its deep gouges. "Kunar Province. A night extraction. The Blackhawk's hoist motor took a round and jammed. I had a critically wounded ranger in the litter. I clipped this to my harness, locked it onto his line, and held his weight with my body while the pilot dragged us 2 miles to safety." Davenport stared, processing the sheer physical impossibility. "You held his life in your hands. He bled out before we reached the surgical tent." She finished clinically. "I kept it to remind myself that sometimes protocols don't matter." Sometimes the only thing keeping someone alive is a person willing to hold the line. That's why I didn't let Sunfield put you to sleep. You give a fighting man a weapon, not a sedative. The door clicked open. Doctor. Sunfield stepped in, her pristine white coat lacking its usual arrogant aura. She looked exhausted. Commander, Sunfield said softly. The debridement was a success. I know, Davenport replied flatly. My nurse told me. Sunfield swallowed hard, looking at Celeste. The power dynamic had inverted completely. Nurse Northcott. Sunfield managed, the words tasting like ash. Dr. Eris informed me you preempted a hypotensive crisis. Had I known you were Tier 1 JMAU, I would have deferred to your assessment. Celeste stepped forward. My background is irrelevant, Dr. Sunfield. You demanded his compliance. I earned his trust. Sunfield flinched. The 12-word indictment stripped away her ego. You failed because you saw a terrified man as an obstacle to your checklist. Celeste continued mercilessly. You treat the chart. I treat the soldier. Until you learn the difference, don't touch these men. Finding only cold agreement in Davenport's eyes, Sunfield nodded stiffly and retreated, carrying the weight of her institutional blindness. By noon the following day, the executive boardroom of the hospital had been commandeered. Dr. Elias Vance, the chief medical officer, sat at the head of the polished mahogany table, sweating profusely through his expensive suit. Flanking him were two high-ranking naval officers, a stern-faced rear admiral from the Bureau of Medicine and Surgery, and a quiet, broad-shouldered captain bearing the insignia of the Naval Special Warfare Command. Celeste sat across from them, wearing her standard navy blue scrubs once again. She sat at parade, rest in the high-backed leather chair, her expression entirely neutral. When we received the incident report regarding a physical altercation involving Commander Davenport, we immediately initiated a background sweep of all personnel involved, the Rear Admiral stated, tapping a thick, red-stamped file folder on the table. When we ran the name Celeste Northcott, the DoD database threw an immediate classified flag. It took me 3 hours and 2 phone calls to JSOC to unseal your service record. Senior Chief. Vance choked slightly on his coffee. Senior. Chief? She is a civilian registered nurse. She was a senior chief hospital corpsman in the Joint Medical Augmentation Unit, the captain corrected, his voice a low rumble of absolute authority. He looked at Celeste with an expression of profound, unspoken brotherhood. 2 silver stars, 3 purple hearts, a Navy Cross citation that is heavily redacted. She has more combat medical experience in her left hand than your entire surgical wing has in its collective history. Dr. Vance. Vance turned incredibly pale, looking at the woman he had suspended and ordered off the premises less than 24 hours ago. The administration, was entirely unaware. That is exactly the point, Dr. Vance, Celeste said smoothly, breaking her silence. The administration is blind. You hire people based on civilian licensure and plug them into a bureaucratic algorithm. When an outlier like Commander Davenport enters your system, your algorithm breaks. Dr. Sunfield almost killed a national asset because your institution values compliance over clinical reality. The Rear Admiral nodded slowly. Commander Davenport has made it explicitly clear that he will refuse all further treatment at this facility unless Nurse Northcott is reinstated and permanently assigned as his primary caregiver until his transfer to Walter Reed. Vance scrambled to recover his authority. Of course, immediate reinstatement, full back pay. In fact, Nurse Northcott, given your extraordinary credentials, we would like to offer you a position as the clinical director of the trauma wing, a massive pay increase, a private office, and you will report directly to me. It was the ultimate bureaucratic olive branch, an attempt to neutralize a threat by absorbing it into the upper management structure. Celeste looked at the chief medical officer, then at the 2 military men who knew exactly how this game was played. She stood up slowly, her hand brushing the blackened carabiner at her hip. No, thank you, Dr. Vance, Celeste said. Vance blinked, genuinely baffled. I don't understand. It's a promotion. You wouldn't have to work the floor anymore. I don't belong in a private office. Dr. Vance, Celeste replied, her voice echoing with the quiet excellence of a true operator. I don't treat spreadsheets, and I don't manage budgets. I belong on the floor. I belong in the dirt, where the blood is. You can lift my suspension, but I am going back to room 412 as a floor nurse. And if Dr. Sunfield or anyone else in this hospital ever attempts to chemically assault a combat veteran again, I won't just throw away a syringe. I will dismantle this hospital's DoD funding piece by piece. She didn't wait for a dismissal. She turned and walked out of the boardroom, leaving the executives and the brass in stunned, respectful silence. When Celeste stepped off the elevator onto the high-acuity floor, the atmosphere had shifted entirely. The story had spread like wildfire. The junior nurses, the orderlies, and the clinical fellows stopped what they were doing and watched her walk down the hall. There was no whispering, no gossip, only a profound, silent reverence for the wolf who had been hiding in sheep's clothing. Vera was waiting at the nurse's station. The veteran charge nurse had tears in her eyes, though a fierce, proud smile broke across her face. She didn't say a word. She simply handed Celeste a fresh, printed patient chart. Celeste took the chart. She walked down the long, bright corridor and pushed open the door to room 412. Davenport was awake, sitting up slightly. He looked exhausted, broken, and heavily medicated, but the terrifying, paranoid tension was completely gone from his frame. He looked at Celeste as she walked in, noting the blue scrubs. "Perimeter secure?" Davenport asked quietly. Celeste moved to the bedside, checking his IV line, her hand steady, efficient, and deeply comforting. "Perimeter is secure, Commander," Celeste replied, her thumb brushing against the blackened titanium carabiner. "Get some rest. I hold the line. True power does not require a podium, and genuine authority rarely needs to scream." Celeste Northcott's journey proves that the most formidable forces operate in disciplined silence. Her refusal to bow to institutional arrogance saved a life, shattering the illusion that rank equates to wisdom. Davenport's survival was secured by the undeniable gravity of earned trust and shared sacrifice. In a world obsessed with titles, this story is a testament to the quiet warriors who carry their heavy burdens without complaint, recognizing that true respect is forged in the dirt, not the boardroom. If this story of quiet excellence resonated with you, please hit the like button, subscribe, and share your own stories of unsung heroes in the comments below.